All right, I want to talk about the increase in respiratory illnesses that we're seeing now, flu, RSV, elevated levels across the country. There's also COVID hospitalizations are trending higher now. So could you tell us a little bit, give us an update sort of on where we stand with all of these things?
I would consider us in our current state of a surge. Right now in the past month, we've seen a raise in the rates of flu by more than 200%, a raise in the cases of RSV by 60%, and a raise in the rates of COVID by at least 50%. And the reasons behind this are a variety of things. Number one, it's colder. We get closer, that increases transmission. Less people than what would be hoped for are vaccinated or updated on their vaccines. Only approximately 18.5% of the population has gotten an update on their vaccine. And then also we have some evidence that COVID-19 can reduce our immune response, which makes us more susceptible to infection. And then, of course, we have these new circulating variants, which likely have some increased transmissibility as a part of the reason why we're seeing these increased numbers.
Yeah, I wanted to talk to you about that new subvariant now that we're dealing with. Should we be concerned about another wave here of COVID infection, and how can we protect ourselves?
Well, I think that the current variant that is circulating, the JN1, the most commonly, thankfully, the public health risk is relatively low. But the mutation that is existing within this variant can confer an increased ability to pass from one person to another. And just for context, in November, it constituted approximately 3% of total cases of COVID. And most recently, it's more than 50% of total cases.
Wow, it's fast moving.
It's fast moving, fast growing. But thankfully, we haven't seen any outcome differences in hospitalization or death. And also, thankfully, it still doesn't seem to be effective against our methods of protection, masking, washing our hands, making sure that we're updated against our vaccines. And so all of those things we can still do. I try to treat this like a forecast. The same way we look at the weather is the same way we should look at these respiratory numbers. Right now, it is quote unquote raining outside. So that's when you grab your rain boots and your umbrella. And the same way you grab your high quality mask, you make sure you're updated on your vaccine, and you remember to wash your hands.
Good analogy. High-quality mask. Remind us what that is.
I consider a high-quality mask something similar to an N95 or a KN95. Most recently, yesterday, I was on the train on my way to Boston to see family, and it felt like a chorus of coughs. Mostly children coughing on the train, very few people masking, and so that's when I grabbed my high-quality mask because I am in a high-risk environment, or at least I consider it that to be, and that helps protect me, but it also helps me from preventing and ruining someone else's holiday. And so that should be our goal for everyone.
Yeah, respectful of everyone that we're sharing this space with. And then finally, should we be doing something different to protect ourselves from flu or RSV versus a COVID infection?
You know, I wish that there was an easy way to figure out exactly what you had just simply based on symptoms. But what I tell patients is most often I don't know just as much as they don't know. There are some symptoms that are associated with one virus rather than another, but overall it's respiratory illnesses. If you feel ill, then that's when you should at least be wearing your high quality mask, avoiding interactions. I know it's really difficult for people not to go to those Christmas parties, but if you feel like you're symptomatic, you probably should stay home. And if you have to go outside and do your normal things in daily life, then that's when you should be wearing that high-quality mask, because it also protects from transmitting it to other people.
Absolutely. Protect yourself, protect others at the same time. Yes. ABC News medical correspondent Dr. Darien Sutton, always great to see you.
Great to have. Thank you so much for having me.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.